What is a medication abortion? In this video, we'll talk about the abortion pill, which is sometimes called a medical or medication abortion. We'll describe how you get it, how it works, and how it feels. In Canada, the abortion pill is offered up to 9 weeks and sometimes 10 weeks of pregnancy, counted from the start of your last period. Medication abortion is legal in Canada and is free if you have Canadian health insurance. So, how do you get the abortion pill? In Canada, you can get a prescription from a family doctor, nurse practitioner, gynecologist, or you can visit an abortion clinic. In some parts of Canada, you can also get care from a midwife. You can expect to have up to 3 appointments, one for the prescription and potentially more for an ultrasound, blood work, or to make sure the pills worked. The abortion pill is highly effective, but in rare cases, people may need a follow-up procedure to complete the abortion. Many providers offer appointments by video or phone, but you will have to go in person to pick up the abortion pills at a pharmacy and, if needed, for tests. You can take your abortion pills at home or at a place of your choosing. Consider what comforts you might need, like access to a bathroom, a comfortable place to rest, or a companion for support. Each provider has their own rules about companions, so check ahead of time if you want to have someone come with you for any appointments. So, how does it work? Medication abortion is made up of 2 prescription drugs, mifepristone and misoprostol. First, you swallow a pill called mifepristone that blocks progesterone, a hormone that supports the pregnancy. Next, between 24 and 48 hours later, you place other pills, misoprostol, between your gums and cheek, under your tongue, or inside the vagina. On average, the abortion is done 3 days after taking the first pill. How does it feel? After taking misoprostol, most people experience cramping and heavy bleeding for 2 to 4 hours. Misoprostol causes your uterus to contract and push out the pregnancy tissue. Some people describe this experience like having a miscarriage or a heavy period. You can expect to use 1 to 2 maxi pads per hour for the first 2 hours after taking misoprostol. Light bleeding or spotting usually continues for 2 weeks, but may last longer. It's hard to predict how painful your cramps will be. For some people, it feels like light period cramps. Others say it feels like labor. Your provider will offer you pain medication. Nausea, fever, and headache are also common. Talk to your doctor if you have questions about managing these side effects. Abortion pills are safe, effective, and have no effect on fertility or your ability to get pregnant in the future. However, seek medical care if you are bleeding through more than 2 maxi pads per hour for more than 2 hours in a row at any time during your abortion, or if you are experiencing symptoms that you're unable to manage on your own. If you are more than 10 weeks pregnant or want to have your abortion in a clinic, you can choose to have an abortion procedure instead. Want to learn more? Check out the links in our description below and visit It's My Choice at sexandyou.ca.